Hello friends, today I am going to discuss option number 3 and 4 of question number 6 of Katherine Anderson mrcog part 1. Option number 3 and 4 are related to femoral nerve. So the content of these videos are femoral nerve, Meralgia, paresthetica, femoral nerve injury, femoral nerve stress test, postpartum femoral neuropathy. Option 3 and 4 are related to femoral nerve. We will solve this at the end of the video. So femoral nerve, it is the largest branch of lumbar plexus. It is derived from posterior division of ventral or anterior rami of L2 to L4. So basically it arises from anterior rami but posterior division. After passes inferiorly through the psoas major muscle, it gives off branches for posterior abdominal wall muscles and enter into the thigh. This green color shows femoral nerve arises from L2, L3 and L4 of the anterior rami, but division is posterior. And in this diagram you can see femoral nerve after arising from L2, L3 and L4 passes directly through the psoas major muscle and give branches to psoas major muscle and then iliacus muscle and then enter into the thigh after passing under the inguinal ligament. Now femoral nerve passes underneath the inguinal ligament to enter the femoral triangle. Within the triangle, the nerve is located lateral to the femoral vessels but outside the femoral sheath. Here you can see femoral nerve shown in green color lies lateral to the vessels but outside the femoral sheath. Approximately 4 cm below the inguinal ligament, it divided into anterior and posterior divisions. As shown in this picture, you can see after passing under the inguinal ligament 4 cm, then it divided into anterior and posterior branches. This is the diagram showing femoral nerve origin and its branches. We don't need to remember all these branches. Just remember that it arises from the dorsal or posterior division of ventral rami of L2, L3, S4, and then there are it divided into anterior and posterior branches, and then there are further branches, and its terminal branch is saphenous nerve, which is sensory. Now saphenous nerve is terminal cutaneous branch of the femoral nerve. It travels through the adductor canal accompanied by femoral vessels and exits prior to the adductor hiatus. This is the adductor canal. The boundaries of adductor canal: medial is sartorius muscle, posterior are the adductor longus and adductor magnus, and anterior lateral are vastus medialis. And contents of the adductor canal is nerve to the vastus medialis, femoral artery, femoral vein and saphenous nerve. Now come to the function of the femoral nerve. It innervates the anterior thigh muscles that flex the hip joint and extend the knee joint. Sensory functions. Two main sensory branches that arise from femoral nerve. One is anterior cutaneous nerve, derived from the anterior division of the femoral nerve. They supply the skin of the anterior medial thigh. As shown in this picture in dark blue color, supplying the anterior medial side of the thigh. Now saphenous nerve, a continuation of the posterior division of the femoral nerve. It supplies the skin of the medial leg and foot, as shown in the light blue color. Lateral femoral cutaneous nerve, it is the sensory branch of the lumbar plexus arising from the posterior division of the anterior rami L2 to L3, and it supplies the lateral side of the thigh. Lateral femoral cutaneous nerve is separate nerve from the femoral nerve, but in 10% of the cases it arises directly from femoral nerve. That is why I discussed this with femoral nerve. Compression or squeezed as it exists, the pelvis causes tingling, numbness, and burning pain in the outer side of the thigh, known as Meralgia paresthetica. As shown in this picture, lateral femoral cutaneous nerve arises. Arises and its root is separate from the femoral nerve, and it supplies the lateral side of the thigh. Now, femoral nerve injury. An injury caused by a fractured pelvis, a catheter procedure in femoral artery because of its close proximity with the femoral artery. Internal bleeding in the pelvis, wearing belt that are too tight, lithotomy position. Nerve damage in the lithotomy position and its prevention I have discussed in my previous video. So if you want to know about these in detail, please follow my previous video. Excessive pressure on the nerve, something pressing the nerve such as tumor or other growth. This is very important. Postpartum femoral neuropathy. It is a complication of vaginal delivery. Its incidence is 2.8 per 100,000 deliveries. Risk factors are nulliparity, prolonged second stage, instrumental deliveries, or regional anesthesia. And in regional anesthesia, such as spinal or epidural, this predisposed to development of femoral neuropathy through loss of pain signals that would prevent excessive hip hyperflexion. So, keep postpartum femoral neuropathy in mind as potential differential diagnosis in women with difficulty mobilizing after regional anesthesia. And be aware of the other symptoms such as sensory loss on anterior thigh, and usually it's unilateral and absent of patellar reflex. Diabetes mellitus with macrosomic baby, gynecological surgery, laparoscopy, and retroperitoneal hematoma. Now, femoral nerve stretch test. We can use this in a way to elicit root stretch in the evaluation of high lumbar radiculopathy. In this, pain may be triggered by knee flexion alone, or pain may be triggered by knee flexion in combination with hip extension. Now, diagnosis. We can diagnose this by history and physical examination. Absent or reduced patellar reflex is the most reliable objective sign of femoral neuropathy. There may also be sensory deficit over the anterior medial thigh and quadriceps weakness. Nerve conduction studies can be used to confirm the diagnosis. Now, the management. It should be managed conservatively and prognosis is excellent. Improved function is expected within 6 to 8 weeks with total recovery in most cases by 6 months. There is lack of clear evidence on how best to manage subsequent pregnancies after postpartum femoral neuropathy. It may be reasonable to offer cesarean section in order to prevent recurrence after full discussion of risk and benefits of both modes of delivery. Now the option C is the femoral nerve divides into an anterior and posterior branch before passing beneath the inguinal ligament. This option is false because femoral nerve divided into anterior and posterior branches 4 cm below the inguinal ligament. The femoral nerve is derived from posterior division of L2 to L4. This is true because femoral nerve derived from posterior division but anterior rami or ventral rami of L2 to L4. Thanks for watching my video. If you like my video, please subscribe to my channel and click the bell icon for more updates. Option number 5, I will discuss that in my next video.